recent years, trauma care has made significant advancements that have greatly improved the chances of survival for patients in critical condition. With the establishment of trauma systems and centers, standardized resuscitation methods, and advancements in blood banking techniques, medical professionals are now able to aggressively resuscitate patients in life-threatening situations. However, despite these advancements, there exists a critical point in the resuscitative process where patients may cross the physiological threshold, resulting in a phenomenon known as the trauma triad of death. This triad encompasses hypothermia, acidosis, and coagulopathy, and understanding its pathogenesis and treatment is crucial in improving patient outcomes. So what exactly is the trauma triad of death? It refers to a sequence of physiological abnormalities that occur in severely traumatized patients, consisting of hypothermia, acidosis, and coagulopathy. These three components collectively contribute to poor outcomes and increased mortality rates. Let's start by discussing hypothermia. It is primarily caused by two factors: severe blood loss and exposure to cold environments. When blood loss occurs, the body's thermoregulatory mechanisms are compromised, leading to a drop in core temperature. Coupled with exposure to cold environments, hypothermia hinders cellular metabolism and impairs clotting mechanisms, further worsening the patient's condition. Now, let's move on to acidosis. This occurs when there is an imbalance in the body's acid-base levels, resulting in increased acidity in the blood. In trauma patients, acidosis is primarily caused by tissue hypoperfusion, which results from inadequate blood flow to various organs and tissues. This switch to anaerobic metabolism leads to the production of lactic acid and increased acidity. This further impairs cellular function, compromising the patient's ability to clot blood effectively and increasing the risk of uncontrolled bleeding. Lastly, let's discuss coagulopathy. In trauma patients, coagulopathy is primarily driven by the consumption and depletion of clotting factors and platelets due to massive bleeding. Without these essential components, the patient's blood is unable to clot effectively, exacerbating the bleeding and preventing the body from controlling it. So how do hypothermia, acidosis, and coagulopathy occur in trauma patients? When a patient experiences severe trauma, several physiological responses are triggered as the body tries to compensate and survive. However, in certain cases, these responses can become detrimental, leading to the development of the trauma triad of death. Treatment options for the trauma triad focus on reversing or preventing the progression of hypothermia, acidosis, and coagulopathy. Prompt recognition and intervention are crucial to improving patient outcomes. Rapid fluid resuscitation is critical in trauma patients to restore blood volume, maintain tissue perfusion, and prevent hypoperfusion-induced acidosis. Blood transfusion may be required to replenish clotting factors and platelets in cases of severe blood loss. Rewarming measures, such as the use of warming blankets or warm air devices, can help combat hypothermia and restore normal cellular metabolism. In some cases, damage control surgery may be performed to prioritize controlling severe bleeding and minimize surgical time. Research on the trauma triad of death highlights the importance of timely recognition and intervention to prevent its progression. By optimizing trauma resuscitation techniques and refining surgical approaches, medical professionals can work towards minimizing the occurrence of the trauma triad. Continued collaboration and research will drive innovation and enhance the chances of survival for patients experiencing severe trauma. In conclusion, understanding the trauma triad of death and its treatment options is crucial in improving patient outcomes. Medical professionals must be well-versed in this triad to implement appropriate interventions promptly and effectively, potentially making the difference between life and death for trauma patients. With further research and advancements, we can continue to enhance trauma care and increase survival rates.